Hello, freshmen. For the first module in the laboratory part of Community and Public Health, we will be discussing the Millennium and the Sustainable Development Goals. Perhaps some of you are not familiar with this, so let us first define what is a goal. So I guess that almost all of you have goals in life, and most of you I know would be to finish your studies and pass the board exam and become successful medical technologist. And others would be to finish medical technology as a pre-med course and push through with medicine. So when we mean goals, we mean that it is an idea or a plan for a future. So when we have goals, we plan and do something to achieve them. It is also similar to a plan, purpose, or an aim. So for these MDGs and SDGs, these are goals set by the United Nations which aim to meet the urgent environmental, political, and economic challenges that the whole world is currently facing. These are also these serve as universal goals. At the end of this module, you are expected to discuss and integrate the concepts, principles, and theories of health on community organizations, development, and related demographic issues, and also to assess critically and objectively evaluated problems related to public health using information gathered from community assessments. Current slide are the specific topics outlined for this module. First one will be a short review of the MDGs, and then under the SDGs, the short history will be discussed, as well as the 17 SDGs and their implementation in our country, or if these goals have already been implemented or are currently implemented in our country. So as a review for the Millennium Development Goals, or the MDGs, so for 15 years, the MDGs aimed to target the objectives in several important areas such as reducing poverty, providing the much needed access to water and sanitation, driving down child mortality, and drastically improving maternal health. They also started a global movement for free primary education, which inspired countries to invest in their future generations. Most significantly, the MDGs made huge strides in combating HIV or AIDS and other treatable diseases such as malaria and tuberculosis. The United Nations Millennium Development Goals were 8 goals that all 189 UN member states, which include the Philippines, have agreed to try to achieve by the year 2015. The United Nations Millennium Declaration, which was signed in September 2000, committed world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. The MDGs have been superseded or replaced by the Sustainable Development Goals, which are a set of 17 integrated goals that build on the achievements of the MDGs, but these SDGs are much broader, deeper, and far more ambitious in scope. So if MDGs are to be achieved by 2015, which has already passed, the SDGs are targeted to be achieved by 2030. So basically, for the SDGs, we still have 9 more years to somehow achieve these 17 goals. So on the current slide are the 8 MDGs that were targeted to be achieved by 2015. So if you look at them, do you think that all these 8 goals were already achieved by 2015? So we are already in the year 2021, so 6 years have already passed. So look at these 8 Millennium Development Goals and reflect if these 8 goals were already achieved. So to enumerate, the first one is to eradicate extreme poverty and hunger. Second one is to achieve universal primary education. Third is to promote gender equality and empower women. 4. Reduce child mortality. 5. Improve maternal health. 6. Combat HIV or AIDS, malaria, and other diseases. The seventh one is to ensure environmental sustainability. And 8 is to develop a global partnership for development. So the question is, have these goals already been achieved? Okay, first one, goal number 1, which was to eradicate extreme poverty and hunger, which is the cause of death among children under 5 years of age, was achieved halfway, meaning that the rate of progress that was achieved is close to the rate that is required to meet this target. And then next one, goal number 4, which is to reduce child mortality, was reduced by 2/3 in children under 5 years of age. However, more countries are achieving high levels of immunization coverage, and during the year 2000 to 2013, estimated deaths by measles have decreased by 74%, which is from 481,000 to 124,000. Goal 5, to improve maternal health, the maternal mortality ratio was reduced by 3/4. To reduce maternal deaths, women need access to good quality reproductive health care and effective interventions. Hence, the universal access to reproductive health was achieved in 2015. Goal 6, to combat HIV, AIDS, malaria, and other diseases such as tuberculosis. So these said conditions have halted or stopped or prevented by 2015, and the spread of HIV or AIDS was reversed. So by 2010, universal access to treatment for HIV or AIDS was achieved because of the increased availability of ART, or what we call as antiretroviral therapy. So what are these ART? Our ART is a treatment for HIV which involves taking a combination of HIV medicines every day. But this therapy does not cure HIV, but rather help people with the disease to live longer and healthier lives. So this ART contributed to a major decline in HIV mortality levels. So how about malaria and other diseases? So malaria and other diseases have halted by 2015 and begun to reverse their incidence. So from 2000 to 2013, malaria incidence and mortality rates of the population at risk have both fallen globally, 30% and 47% respectively. So this was done by interventions such as the increase in the distribution of insecticide-treated nets and indoor residual spraying. And then how about for other diseases? So when we mean other diseases, we also mean other neglected tropical diseases, which are a medically diverse group of infectious conditions caused by a variety of pathogens. So examples of these neglected tropical diseases are trypanosomiasis, which is now targeted for elimination as a public health problem by 2020. Another neglected tropical disease is dracunculiasis, which has been targeted to end or interrupt its transmission by the end of 2015. Goal 7, which is to ensure environmental sustainability, this target was already met, which relates to access to safe drinking water. Basic sanitation progress is too slow to be achieved globally because billions of people did not have access to improved sanitation facilities. So most of the people living in urban areas do not have access to improved sanitation because of the rapid growth in the size of urban populations. The next one is to develop a global partnership for development. Scarcity of medicines in the public sector, which forces them to buy from private sectors where prices can be much higher. So, effective treatments for the majority of chronic diseases still exist, and the universal access remains out of reach. So, the other two goals, which I haven't mentioned, are still part of the SDG, which is to achieve universal primary education and to promote gender equality and empower women. And until now, we are still in the process of achieving these goals. So we will not tackle them in detail since their target has already passed, which is until 2015. So for now, we will be discussing the SDGs, which have replaced these MDGs, which are targeted to be achieved by the year 2030. So before we proceed with our discussion about SDGs, let us first differentiate MDGs from SDGs. I have made a table of their differences with each other, as you can see on the current slide. So the SDGs were created based on the success of the MDGs, which, as I have mentioned earlier, embodies specific targets and milestones to eliminate extreme poverty and human deprivation. So for the number of goals, the MDGs have 8. For the SDGs, they have 17 goals. For the general scope and focus, MDGs only focus on social, while for SDGs, it focuses on economic growth, social inclusion, and environmental protection. The target for the MDGs are the developing countries, particularly the poorest, while for the SDGs, they target the entire world. So it is much broader because it involves the rich and the poor. And then for the formulation, the MDGs were produced by a group of experts, while for the SDGs, these are the result of consultation process among the 193 UN member states, among the civil society, and other stakeholders. Since we just made a quick review of the MDGs, let us now proceed to the SDGs, which is our main topic for this module. The legacy and achievements of the MDGs provide us with valuable lessons and experience to begin work on the new goals. But for millions of people around the world, the job remains unfinished. We still need to go to the last mile of ending hunger, achieving full gender equality, improving health services, and getting every child into school beyond primary education. The SDGs are also an urgent call to shift the world onto a more sustainable path. Since it all started with the MDGs, that's why these SDGs are a bold commitment to finish what was already started through the MDGs and tackle some of the more pressing challenges facing the world today. The SDGs are unique in that they cover issues that affect everyone. As has been mentioned in the table from the previous slide, SDGs are for everyone, whether you are rich or poor. They reaffirm our international commitment to end poverty permanently everywhere. They are ambitious in making sure that no one is left behind, and more importantly, they involve us all to build a more sustainable, safer, more prosperous planet for all humanity. So the SDGs are officially known as Transforming Our World, the 2030 Agenda for Sustainable Development. These are also universal goals that balance the three dimensions of sustainable development, which are social, environmental, and economic. So this is economic. Okay. The objective of these SDGs is leaving no one behind. That is why it is for everyone, whether rich or poor, so it is more comprehensive compared to the MDGs. And these SDGs have been adopted on September 25, 2015 to stimulate action for people, planet, prosperity, peace, and partnership. So from the 8 MDGs, they came out with 17 SDGs since it targets everyone. So the goals have become more comprehensive. So we will be discussing each SDGs one by one as we go on with our discussion. So on the current slide are the 17 SDGs. These SDGs are targeted to be achieved by the year 2030. So since we are already in the year 2021, we still have 9 more years for us to achieve or to improve all these 17 goals. For these goals to be achieved, everyone needs to do their part. Who are these people who need to do their part? The first one is the government. Government plays a key role in achieving the development goals and targets through, for instance, setting and implementing policies, rules, and guidelines. Another one are the private sector. So the private sector is a key player to effectively achieve the SDGs and the 2030 agenda. The SDGs represent a common language for all actors in society to contribute to sustainable development and constitutes a global framework for businesses to align and contribute to society. So this private sector is the part of a country's economic system that is usually run by individuals and companies rather than the government. So most public or most private sector organizations are run to make a profit. Okay, on the other hand, the segment of the economy under the control of the government is known as the public sector. So, example of private sector are law firms, aviation, real estate. Okay, so for the civil society, on the other hand, includes charities, non-government organizations, community groups, women's organizations, professional organizations, trade unions, social movements, and many more. So in the Philippines, example of these civil societies are the National Food Authority, National Tobacco Administration, the Philippine Crop Insurance Corporation, and many others. And of course, you can also do your part in your own little way to help in achieving these goals. So as we discuss each SDGs, I want you to think of 1 or 2 ways in which you as a student, as a daughter or son, as a future medical technologist, as a citizen of our country, ways on how you can help in achieving each of the SDGs. Poverty does not just mean no food to eat. Poverty is a state or condition in which a person or a community lacks the financial resources and essentials for a minimum standard of living. It means that the income level from employment is so low that the basic human needs cannot be met. Examples of these basic needs are clothing, food, water, and shelter, among others. So for goal number 1, which is to end poverty in all its forms everywhere by 2030. So by this year, the poor and the vulnerable should have equal rights to economic resources as well as access to basic services. And about 1 billion people still live in poverty, which is according to 17goals.org, is defined as an income of less than $1.25 per day. Or if you are going to convert it to peso, assuming that we have an exchange rate of 50 pesos for a dollar, 1.25 US dollar is equivalent to 62.50 per day of income. So ang baba. So we may eradicate poverty by the provision of the government decent employment so that the poor and the vulnerable may be able to access their basic needs, or they can be able to buy food, to have a shelter, to have clean water for drinking. So to achieve this, our goal is to end poverty in all its forms everywhere. So first, what are the causes of poverty? First one is unemployment. So meaning that when a person is unemployed, he or she is unable to provide for his or her basic needs such as food, shelter, clothing, and water. So being unemployed also excludes a person socially, and since he cannot provide for the basic needs, they are prone or vulnerable to disasters such as flooding, earthquake, and diseases which can hinder them from being productive. So for example, you cannot able to buy your basic needs such as food because you're unemployed. So the tendency is magugutom ka. So you are vulnerable to diseases which can likewise hinder you from being productive. So sakitin ka. So how are you going to work? Okay, so imagine yourself now being deprived of food. So the tendency is that your immune system will weaken, which can make you vulnerable to acquiring diseases which can affect your day-to-day activities, such as being unable to go to work or school because you are sick or unhealthy, or you are feeling unhealthy or sick. So to eradicate or prevent poverty, what should be the priority plan of actions to take? First one is to access to sustainable livelihoods, meaning the provision of livelihood programs and supporting small-scale businesses. So just to add an update, before COVID-19, the world has already been able to eradicate poverty from 15.7% in 2010 to 8.2% in 2019. So bumaba siya. So however, because of the COVID-19 implications, it causes the first increase in global poverty in decades, since more than 71 million people are pushed into extreme poverty in 2020. So the arise of this pandemic caused many people around the globe to lose their jobs. It also causes economic losses and other circumstances, causing many people to live in poverty. Universal access to basic social services. So what are these social services that we have in the Philippines? We have the Listahanan, Pantawid Pamilyang Pilipino program, or the 4Ps, Supplemental Feeding Program, which are under the DSWD, and many more other programs that should be accessed by everyone. Productive employment and opportunities for the poor. So to alleviate poverty, properly paid employment for everyone should be provided so the poor can be able to sustain their basic needs. Goal 2 is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Causes of hunger may be brought about by climate change, which causes drought and flood, and another one is because of food wastage. So to end hunger, this plan of action should be done. First one is to support local farmers and markets. So we have to buy our own and from our farmers instead of buying imported ones. Next one is to minimize food wastage. An example of this is to order just enough rice whenever we are in the restaurants to avoid wastage, and just order foods or products what we can only consume and not in excess. So sometimes we tend to order extra rice and then kapag kakain na tayo, hindi natin siya nauubos. So, nagkakaroon tayo ng food wastage. Okay. Ending hunger can also be achieved by improving agriculture. And how are we going to do this? We have to increase investment. We also have to engage in agricultural research, technology development, and also to enhance agricultural productivity in developing countries, especially those least developed countries. So for the improvement of agriculture, so pwede tayong mag-research regarding how are we going to produce more but quality products. Okay. Goal 3 is to promote good health and well-being. This goal aspires to ensure health and well-being for all, including a commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030. Action plans to achieve this goal is by providing access to affordable medicines and vaccines. Examples are the generic drugs that we can buy from the drugstores, which are much cheaper but as effective as the branded ones. Okay, another problem that we have right now, most especially here in our country, is our lack of health practitioners, brought about by low salaries from both public hospitals, private and public hospitals and clinics. That's why most of those that are in the health workforce, including us medical technologists, resort to going abroad for a much bigger income and many benefits and opportunities. So by increasing health financing, many of those who are in the health workforce will choose to stay and work here instead. The government should also provide numerous and free training and development programs to be able to give them enough training and knowledge about healthcare system. The third one is to strengthen the capacity of countries for early warning, risk reduction, and management of global health risk by the various programs of the LGUs or the local government units for the prevention of the sudden onset of diseases. Lastly, is to reduce mortality from non-communicable diseases through the prevention and treatment and promote mental health and well-being, and by strengthening the prevention and treatment of substance abuse, including narcotic drug abuse, and the harmful use of alcohol. So just to add regarding vaccines, so nakapanahon tayo, no, the issue about the COVID-19 vaccine. So yung issue ngayon is not everyone are capable of getting the COVID-19 vaccine because wala tayong budget, or yung iba super poor, so they cannot afford to buy this vaccine. So ang mangyayari, unless the government give them free vaccines for COVID-19 vaccines for free, that will also be the time that they can be able to access or have access to COVID-19 vaccine. So nakikita nyo yung problema, di ba? Goal 4, to ensure inclusive and quality education for all and promote lifelong learning. So this goal ensures that everyone is provided a complete and free quality education. Also, everyone should have equal access to technical, vocational, and tertiary education. This will be for everyone, meaning that it should include persons with disabilities, indigenous people, and those children who are in vulnerable situations. This goal uh, also aims to upgrade education facilities as well as to increase the number of qualified teachers. And however, the achievement of this goal will not be possible because of the lack of adequately trained teachers and poor conditions of schools. And with the emergence of COVID-19, the achievement of quality education became a challenge. Just an update with regards to the status of this goal. Before COVID-19, the achievement of this goal was too slow, with a projected 200 million children who are still out of school by 2030. When COVID-19 became a pandemic, which caused the closures of schools, 90% of students were out of school. COVID-19 caused the schools and universities nationwide to continue learning through remote or online learning, just like what we are doing now. However, it was still out of reach for at least 500 million students, and only 65% of primary schools have basic hand washing facilities, which is very important nowadays for the prevention of the said disease. What is the possible action plan to achieve this goal? The first one is to provide free education to everyone. Currently, here in our country and other countries as well, primary and secondary education is given free sa public. Okay. And with the state colleges and universities, college students are also provided with free tertiary education. And some only pay miscellaneous fees, which is very helpful to poor students. And likewise, scholarships should also be given to students as well as proper training and seminars to teachers. The next one is to build and upgrade educational facilities, which are very helpful to provide a conducive learning environment to students. So